Our success story starts in Morocco. When he came here, the first time we met, he couldn't sleep well, he couldn't breathe well. In the first photo, Dr. Hasan Erden and our team finished his operation. Kefir, ayran, Actimel, broth, having more energy, breathing better. When I see this kind of change, it makes me very happy because this is my motivation. Hello everyone, I'm Dietitian Christophe from Dr HE Clinic, and today I'm here to explain a success story and new beginnings. Our success story starts in Morocco. Our patient from Morocco has contacted us to ask his questions about the surgeries and processes. He had an online consultation with our doctors, and then after his online consultation, he was sure to come to Turkey, and he came all the way to Turkey. When he came here, the first time we met, he talked about his objectives, and we started with his preparations because the preparations part is very important for the surgeries. While we were doing the preparations, we did make a weight measurement as well. And when we did his weight measurement, his fat percentage was very high. And this fat percentage was causing problems for him, like sleep apnea. He couldn't walk like he wants, he couldn't be active, he couldn't sleep well, he couldn't breathe well. So he told me he wanted to change everything. So we started to talk about his objectives. As you can see in the first photo, his BMI was over 60 and his starting weight was 240. After his preparations, we started with his operation. Dr. Hasan Erden and our team finished his operation and we met in his room. The first thing that I did was bringing him water, because after this kind of surgeries, water intake is very important. Because after the bariatric surgeries, for the recovery and to have enough energy, we need to drink enough water. And when he started to feel better, as you can see in the video, he started to walk, because walking part is important. After these surgeries, the patient has a lot of gas and that can cause a little pain and sometimes nausea. And to help with this nausea and pain, walking is crucial. Then he finished his first day at the hospital. The second day, the first day after surgery, the first thing that I did was visiting him in the morning. He was feeling much better than the first day. So we started with the fruit juices and fennel tea. Fennel tea helps with the gas and fruit juices gives more energy. Then day by day he started to feel the difference. After the first day he continued to be active, and the second day we started with the liquid diet. We give him different options like fruit juices, kefir, ayran, Actimel, broth, tea, and we explained him all the details about the liquid diet. And the most important thing, the protein shakes, because protein is very important after the bariatric surgeries. He was explaining me that he wanted to change a lot of things in his life. He wanted to spend more time with his children, being active, having more energy, breathing better. And I told him that we finished the first step. Now we will enjoy the process. The pure diet is the second stage of the adaptation. After the liquid diet, we do 10 days of pure diet and then we start with the solid diet. With a normal life, we can say. When we start with the solid diet, when we was talking about the solid diet, we mentioned the rules that he need to pay attention, like the separation rule, and at the same time the elements that he need to avoid. Because this is a process and everybody is special. Our bodies are different. The elements that are good for us and bad for us can be different as well. So I told him that the most important thing is discovering our body. This is a new beginning and we have a new body. So we need to discover our body to find our balance. That's the most important thing. And when we were talking about the solid diet, he asked me about some elements and I told him the elements that he need to avoid to have a successful objective. Because there are some elements that we need to avoid in our lives. Yes, they are part of our lives, elements like potatoes, fizzy drinks, alcohol, bread, pasta, rice, desserts. Yes, they are part of our lives, but we need to have the limits. Like I said, the most important word is balance. So after talking about his diets, we finished the last checkup and we sent him to Morocco. But we was always in contact, because when he had questions or when he had a problem, we had the WhatsApp group. he was always writing messages to us and about his process as well. The good news, not only the problems and questions, the good news are very important for us. They make us very happy, and we continue with the process like that. And then first year passed very quickly because we were getting only good news. And when we finished the first year, the best news was he lost 115 kg. So we reached our objectives because we have objectives after this surgery. Like first month objective is 10% of the initial weight, third month 20%, sixth month 30%, and the first year 40%. So he had the total loss of 40% in the first year. That was very good, but we still have some steps to take. When I see this kind of change, it makes me very happy because this is my motivation to see new beginnings, healthier lives. So you can see the difference. When we compare with the first photo, here his fat percentage was very less than the first one, and he was breathing better, sleeping better, walking better. He had more energy to spend with his children, and we were very happy to see these changes with him. And with these pictures, we talk about his objectives. Yes, we got a very good result, but we still have some steps to take. So we will continue like that in contact, and I'm sure we will reach our objectives together.